Welcome, everyone. I'm Annika Izagiri. I'm Communications Director with the Committee to Protect Healthcare. We appreciate you joining us today to hear from 3 Wisconsin physicians who are sharing their concerns about former President Trump's healthcare stances ahead of his visit to Prairie du Chien tomorrow. Before we begin, I would like to state that these physicians are speaking as individuals and with us at the committee, not on behalf of any employers. So we please ask that you refer to them in any coverage as they introduce themselves and not on behalf of any employment affiliations. So thank you in advance for respecting that. Now I will introduce our first speaker, Dr. Abbotts.
Good morning. My name is Dr. Leslie Abbotts. I am a practicing OBGYN in Sheboygan, Wisconsin. And we're here today ahead of former President Trump's visit to Prairie du Chien tomorrow. The Trump campaign says he will be speaking about immigration, which doesn't come as a surprise. In his recent campaign events, he has largely shied away from other critical issues like health care. As an OBGYN, I am concerned that Donald Trump's healthcare vision for America would lead to more health insecurity for patients across Wisconsin and the country, particularly women. Despite Mr. Trump's effort to distance himself from Project 2025, we know the blueprint for a second Trump term was written by 140 former staffers of his. We know that in 2016, Mr. Trump said he supports punishing women who have abortions. We know that he is proud of ending Roe v. Wade, the law protecting a patient's freedom to have an abortion. Just recently, he said he had no regrets about it. We know that Trump and J.D. Vance would support a national abortion ban, superseding all state protections, and they wouldn't stop there. We know that by eliminating Obamacare or the Affordable Care Act, which he tried to do dozens of times when he was in office, Mr. Trump will make contraception more expensive and less accessible for women. And I think this is really an important point. The Affordable Care Act requires insurance plans to cover all FDA-approved birth control methods for women without out-of-pocket costs. So since 2010, women had really had excellent access to contraception, and prior to that, many contraceptives were not covered under their insurance plans. Tens of millions of American women now have birth control coverage without out-of-pocket costs. Project 2025 recommends several restrictions on abortion that would severely affect the practice and delivery of health care, especially reproductive care. It recommends ensuring that training for medical professionals and doulas is not being used for abortion training. Page 474 wants the Emergency Medical Treatment and Labor Act, also known as EMTALA, to open the door to possible criminalization of doctors who are involved in abortions in the face of medical emergencies. From the perspective of standard medical practice, Project 2025 is worrisome because it quite explicitly rejects the notion that abortion is healthcare. It also includes personhood language and policies that propagate the belief that life begins at conception. This so-called personhood language could ban not only abortion, but also some forms of birth control and assisted fertility treatments like IVF. Trump's healthcare vision threatens the nearly sacred promise doctors take to protect patients' privacy by requiring states to track pregnancies and abortions, information that can only come from a doctor's office. Mr. Trump isn't just threatening the security of every Wisconsinite's healthcare. He is also threatening doctors' security by virtually preventing us in many instances from practicing medicine to the acceptable standards of care. By banning abortion, Mr. Trump will take away people's freedom to make medical decisions about their own bodies. People will be forced to be pregnant, even if complications threaten their health, and even if they are victims of rape or incest. As physicians, we are all extremely concerned about Mr. Trump's vision for healthcare because it threatens health and freedom of patients across our state and our country. We deserve to hear from Trump tomorrow on these critical health issues. I'd now like to introduce Dr. Charles to speak.
Thank you, Dr. Abbotts. My name is Dr. Joel Charles. I'm a family physician in Crawford County, Wisconsin. I grew up in a low-income neighborhood in Green Bay. I saw people suffer, and I know what it's like to suffer myself. I became a doctor so I could help people who are suffering. And I've learned over my career that in order to do that, sometimes I need to step out of the exam room to do what I can to make my patients' lives easier, even if doing so is uncomfortable. Today, that means making my position clear that as a doctor, it's clear to me that Donald Trump is bad for our health. Now I live and care for people in rural Crawford County. I respect my patients and I care about them. They are smart, hardworking, caring people, and they deserve the best. They are also suffering, and many of them justifiably feel angry and afraid. In healthcare, we have a long history of having to deal with snake oil salesmen. The defining feature of snake oil salesmen is that they don't care and they can't help. The most dangerous snake oil salesmen are the ones who can see people's fear and anger and are willing to lie, promising help they can't deliver and taking advantage of that fear for their personal gain. As a doctor, I know snake oil salesmen when I see one, and above all else, Donald Trump is a snake oil salesman. He sees people's justified fear and anger and uses it for his personal gain. He lies, promising he can help, when his policies would only profit him and his wealthy friends, while making life harder for Wisconsinites. The particular snake oil Donald Trump will try to sell this weekend is the idea that if we just demonize immigrants, that all our problems will go away. This is a strategy to distract from a history and agenda that will hurt Wisconsinites. Donald Trump and MAGA Republicans will make people's lives harder. They will make people sick. They will make medications and healthcare less accessible and more expensive, and they will limit people's freedom to make decisions about their health. Snake oil salesmen like Donald Trump are most dangerous when the source of people's suffering is hard to fix. The reality is that to heal our communities, to soothe the fear and anger people feel, it takes time and hard work and knowledge and caring, and it can be frustratingly slow. Donald Trump and MAGA Republicans have none of that. But I believe Kamala Harris and the Democrats are ready to do that work, that they care, and that they have the plans that will make people's lives better. No matter where in Wisconsin we live, whether we're new or our family has been here for generations, we all want a future where our families can thrive and not just survive. Whether we do our work with a keyboard or a hammer, whether we sit on a desk or a tractor seat, we all want our families to have a future that is better than our past, so we can have the freedom to enjoy life with the people we love. Kamala Harris and the Democrats care, they have a plan, and they will put in the hard work to give people those freedoms. Donald Trump is selling snake oil. He takes advantage of our fear. He tries to divide us so he and his wealthy friends can profit. Wisconsinites have come together across races and places over the last 6 years to tell Donald Trump and MAGA Republicans that we don't want their snake oil, and we will do it again on November 5th. Thank you. I'd like to pass it along to Dr. Mark Newman.
Thank you, Joel. My name is Dr. Mark Newman. I am retired pediatric critical care doctor. I devoted the last 10 years of my career to the practice of caring for children in intensive care units. And in those situations, you will see families in the most anguishing circumstances that one can imagine. I've been there seeing their anguish, their fear, and I've shared their tears as their children suffered from serious diagnosis like cancer or serious life-threatening injuries. Many of them were also experiencing the anguish of financial toxicity. When besides seeing their young daughter perhaps on the verge of dying, they also have to consider how their medical expenses will weigh upon their entire family. Grandparents and parents anguish with those issues. Unfortunately, in Wisconsin, we have over 200,000 families who find their health insurance through the Affordable Care Act. To play with that resource is beyond immoral. To put those families into a circumstance where they would have to worry, how are we going to manage the payment after our child is recovered, or even worse, has not survived. You can easily imagine that a father would be contemplating selling the farm for the sake of saving the life of his daughter. And also, besides that, we have children who have congenital illness that in years past would not have survived, but now, due to the wonders of 21st century medicine, they do survive. But these also are circumstances that provide financial toxicity to families and worries that are relieved by our communal sources of health insurance. These notions of a health plan that former President Trump has talked about can be of no solace for families as they contemplate these possibilities, particularly here in Western Wisconsin, where Mr. Trump will be visiting in Prairie, Chien, where we have so many families who are self-employing because they have farms or small businesses, and they would not have the availability of employer-based health insurance plans. Therefore, I think as our former President Trump comes to visit Western Wisconsin, that we need people to ask him, where does he really think he can go with these notions of a health plan? Thank you.
Thank you so much, Dr. Newman, Dr. Charles, and Dr. Abbotts. We'll now open it up for questions. If you have a question for one or any of the physicians, you can put it in the chat box. You can use the Q&A function, or if you prefer, you can raise your hand and I can unmute you to ask the question. So we will allow a few moments for folks to be able to do that. And I had a question chatted to me. I will put it in the box for you all to see. Senator J.D. Vance suggested last week that a Trump administration healthcare plan could involve splitting up people who are healthier and people who rely on the healthcare system more into different risk pools. What would this mean for Wisconsinites? And that's for anyone to answer.
So that shows a fundamental misunderstanding of what healthcare insurance is. Healthcare insurance fundamentally is the idea that we all do better when we all sort of throw our hats in the ring together, and that some of us are going to be more sick and some of us are going to be less sick, but that we're all safer if we sort of all throw our rings in the pot, throw our hats in the ring together. And the fact that Senator J.D. Vance would even suggest this just shows a fundamental misunderstanding of how health insurance works. And the end result would be that it would hurt Wisconsinites, it would make our care more expensive, and the people who need care the most would have their healthcare costs go up, and that fundamentally is just unacceptable.
It's also true that we all risk the possibility of injury, serious illness, and hope that's not a plan. But this notion that J.D. Vance proposes means that we're all going to just hope that it's not us who become ill and that it would be someone else. And therefore, why should we want to take the risk of having to help support them? Ultimately, the only way for a community to have good health is for the community together to support one another in the provision of those plans and those care plans.
I think the other thing is that obviously we would be, if that were to come to pass, we'd be looking at pre-existing conditions again. And that was one of the really great things about the Affordable Care Act, is that people can get insurance even with pre-existing conditions. And obviously, if we went back to that, it would hurt many, many, many people.
Thank you all. I'm putting another question that was chatted to me in the box. As President Donald Trump made it easier for insurance companies to offer short-term limited duration plans, sometimes called junk insurance, how do these sorts of plans impact patients? And that's for anyone.
The provision of health is a long-term proposition, because it's not just a point in time when we become sick, but we want to promote health, the length of a human life from birth until death. And so the model of having a short-term health insurance plan is worse than just putting a Band-Aid on a reality that we all need to live with. It just plays upon people's self-centered selfishness over the possibility of participating in a larger approach to our healthcare provision in our whole country.
I would add that this is just another example of Donald Trump's approach of decimating standards across government. Standards are there because we have basic needs that we need to have met. We want to know that when we start to work for an employer, that the health insurance that they're offering is going to meet our need when we're at our moment of greatest need. And this is just another example of President Donald Trump's willingness to weaken those standards and frankly harm our health and our well-being by doing so.
Thank you, Bill. I have one more question that I see so far to share. Donald Trump has indicated that he would repeal the Inflation Reduction Act, which, as we know, capped insulin and out-of-pocket drug costs for seniors. How would taking away these caps impact your patients?
We have a long-term issue of covering our health costs in the United States of America. Our healthcare industry is a $4.5 trillion operation, 18% of our entire economic work. And it's the most expensive relative to other countries in the world. In fact, our health expenditures are about twice as much as European advanced economies are. And a big part of that is all of the expenditures that we make in paying for medications. And so this possibility of negotiating the cost of those medications for all the beneficiaries is something that other countries do. In the United States, this has been hard for us to achieve, but finally, it has been achieved to at least a very limited degree. And it opens the door to getting a handle on our exorbitant healthcare costs that we as a nation have to continue to deal with.
Totally agree. It's just pretty ridiculous that the same medication in the United States can cost 10, 20 times as much as the exact same thing in Canada. And that's because the lobbyists and the big pharma money has been there for the Republican politicians to vote against Medicare being able to negotiate drug prices. And so finally, we have something in place for only 10 drugs, but hopefully it will expand eventually to many, many, many more. I think another thing to make really clear is that the biggest cause of bankruptcy for citizens of this country is medical debt. Mm-hmm. And, anything we can do to reduce the cost of medicine is obviously going to be important to almost everybody.
Yeah, I agree. I mean, this is just another example of Donald Trump's willingness to make life harder and more expensive for people. We're finally, I have a lot of patients who struggle. Sometimes they have to choose between their medicines and their rent or paying their utility bill. And we've finally given Medicare the power to negotiate these drug prices. And the Inflation Reduction Act also, frankly, has many other policies that are lowering energy prices, that are sort of moving in the direction also of lowering rent prices, or at least a plan to do so. And the FCC under Lena Khan has also started to bring down the prices of inhalers, for example, and has done a lot of great work also really cracking down on entities, for example, that are gouging rent prices. And so fundamentally, what we're talking about here is the government should be able to negotiate reasonable prices for medicines, and that it also should be able to set standards in many marketplaces to make sure that people's lives are affordable. And that's essential for health. And that's why it's so important that Donald Trump not be elected president again, frankly.
Thank you all. I am not seeing any other questions. I will also mention quickly that we have been recording this, so if you would like a copy of the recording, I can send that to you after. Just shoot me an email where you RSVP'd for this, and I'll get that to you. But I want to thank everyone who was able to join today. I know it's a busy time, so we appreciate you being here. And thank you so much, Dr. Newman, Dr. Charles, and Dr. Abbotts for your time and your advocacy today. We really appreciate you being here today.
It's
Thank you.
a fine occasion to be here. Thank you, Anika.
Thanks, everyone.
Yeah, thanks.